How often do benign bone tumors recur? When it comes to benign bone tumors, a common question arises. How often do they recur after treatment? Understanding this can help patients and their families navigate their treatment options. Benign bone tumors, especially giant cell tumors of bone, have a notable potential for local recurrence. The recurrence rates can vary significantly, typically ranging from 5% to 50%. On average, around 20% to 30% of patients may experience a recurrence after their initial treatment. Several key factors influence the likelihood of recurrence. First, the size of the tumor plays a crucial role. Tumors larger than 5 centimeters have a recurrence risk that is approximately 2.8 times higher than smaller tumors. This means that larger tumors may require more aggressive treatment to minimize the chance of coming back. Next, the surgical method used to treat the tumor is also important. For instance, simple curettage, which involves scraping out the tumor, has a much higher recurrence rate. In fact, this method can lead to recurrence rates up to 5.75 times higher than more aggressive surgeries like en-bloc resection or amputation. For example, if a tumor is treated with intralesional curettage, the recurrence rate can exceed 50%. In contrast, wide resection can reduce recurrence rates to under 5%. The location of the tumor is another factor to consider. Tumors situated in certain bones, such as the proximal fibula, tend to have higher recurrence rates compared to those in locations like the distal femur. Additionally, age can influence outcomes. Younger patients, particularly those between 20 and 39 years old, often face higher recurrence rates. If a patient experiences a first recurrence, the risk of a second recurrence remains significant, around 20%. A third recurrence can also occur with a similar frequency. The choice of surgical approach for recurrent tumors can affect outcomes, with en-bloc resection generally leading to lower recurrence rates, though it may come with more functional compromise. Other factors, such as soft tissue extension and pathological fractures, can also impact recurrence risk, but their influence often depends on how aggressive the surgical treatment is. In summary, benign bone tumors like giant cell tumors can recur frequently, especially when treated conservatively or if they are large or in high-risk locations. It is crucial for patients to have careful surgical planning and follow-up to manage and reduce the risk of recurrence. Always consult with orthopedic oncologists to receive personalized advice tailored to specific tumor characteristics and overall health.